Thank you very much, Miss Mira and also Miss Farah. So for the next session, I would like to invite Dr. Fu Chainin. She's presenting disease surveillance system in Malaysia. So Dr. Fu Chainin is an assistant professor from Faculty of Medicine and Health Science from University Tunku Abdul Rahman. Okay, so now let us welcome Dr. Fu Chainin.
Hello everyone, good morning. Thank you Mr. Tan for your kind introduction here. So good morning everyone and 大家早上好. So I will share my screen now. Okay, so today I will talk about these disease surveillance systems in Malaysia. So why it is so important, because in the current pandemic of COVID-19, and actually our Malaysia and WHO is actually mainly focused on this disease surveillance, and it is one of the top priority now for this communicable disease control. Because from time to time, there are also disease outbreaks, okay, where Malaysia lacks of the experience and detailed understanding of the disease that is necessary for the control of the outbreak. And also recent incidents of the disease also have highlighted the need for more effective surveillance and the response mechanism in this preventing and also to controlling the transmission of the disease. So besides the disease surveillance, this also is highlight the importance of preventing this HIV or AIDS and also tuberculosis here. So these are the outline for today's topic. Firstly, I will introduce what is called disease surveillance, and there are types of infectious disease surveillance in Malaysia here. Firstly, is the infectious disease surveillance is the mandatory notifiable disease, is a must. And also we are based on laboratory-based surveillance, clinical-based surveillance, and these disease surveillance by other agencies, for example, in these foreign workers or other zoonotic diseases. And one of the case example for this SARS and some of the challenges and recommendations. Globally, infectious diseases are a leading cause of this morbidity and mortality, and this contributed estimated of 11 million deaths yearly worldwide. And the introduction of these disease surveillance is because the use of surveillance to actually inform this guinea worm disease, okay? And what is this surveillance meaning and definition meaning here? So surveillance is the ongoing systematic collection of these significant data based on case reports or based on these medical reports, okay? And we actually conduct it through this systematically analysis and interpretation of this health data for daily or for monthly. So it includes the timely dissemination of the resulting information for assessment and specifically for this public health prevention. And finally, to reduce morbidity and mortality and to improve general overall population health here. So surveillance here is very important and is an essential for this public health planning, implementation, and this evaluation, whether it is effective or not effective to actually control and to prevent this transmission of the disease. The objectives of this public health surveillance, including this the detection and the prediction of the outbreak or epidemic or this pandemic here. And we also use the surveillance data to monitor the disease trends and whether the implementation of the public health program, whether it is effective to actually control it, and to daily detect the changes for whether our health practices, our health policies, and these health behaviors that are implemented in our population here, whether it is effectiveness. So in the role of these public health surveillance, it actually we generate hypotheses and also involve the research, whether to determine whether it is effective and it is appropriate to actually towards that disease. And also the progress of these infectious disease surveillance made the very crucial that very important in our this population health, and also globally. I believe that every country there has there is own the disease surveillance system in their own country, because if the lacking of surveillance and a control program, it will actually we can't actually timely detect or this predict the outbreak. So basically, the health and medical services in Malaysia is the responsibility of our Ministry of Health Malaysia. And currently, there are 122 hospitals, 858 health clinics, and more around 2,000 of community clinics in the country. The community clinics meaning that actually the each community or the individuals in that particular community, they could actually access to the nearest health facilities within the 5 kilometers. That's why we have around 2,000 of community clinics in the country. And out of the 123 Ministry of Health hospitals, there are 21 hospitals that have isolation rooms with facilities to enable patients with highly infectious diseases to be treated. And our Institute of Medical Research, IMR, and University Malaya Medical Center, University Malaya Sarawak, in our and also National University Hospital Malaysia, University Science Malaysia, and Veterinary Research Institute provide these viral isolation facilities here, because not all facilities provide these laboratory-based surveillance. It's only these few facilities provide these viral isolation facilities. And the Institute of Medical Research, IMR, is the only laboratory to provide virology investigations in the emerging outbreak situation. For example, for the current pandemic, this COVID-19. And our disease surveillance mainly according to this Prevention and Control of Infectious Disease Act 1988. So all medical practitioners must notify this mandatory disease to the nearest district health office upon detection. However, the medical practitioners will notify the diseases on the administrative orders or on this voluntary basis, where there is newly emerging infectious diseases which are not in the list, like a COVID-19, in order to protect the public from the disease. Else, the medical practitioners will actually notify the diseases based on the Prevention and Control of Infectious Disease Act, the 1988. And the authorized officer is responsible to quarantine any suspected person who have infected by the communicable disease. So now I will we will discuss about the infectious disease surveillance systems in Malaysia here. So basically, the disease surveillance divided into indicator-based surveillance, or we so-called event-based surveillance here. So what is the differences between indicator-based surveillance and these event-based surveillance here? So event-based surveillance is basically based on the flood or landslide, or the explosion and the fire, or any carbon monoxide, this poisoning. And this event-based, we actually is like a rapid capture of the information about the events that are actually potential risk or actually concern to the public health. So information from this event-based surveillance include the rumors or any ad hoc reports, okay, obtained from either from the formal channel, establish a routine reporting system, or the informal channel, including the media, from the health workers reports, and also non-governmental organization reports. And indicator-based surveillance is based on the diseases that already listing out in our this act here. So we can actually collect it, analyze it, and interpret here, and also we monitoring, and finally we evaluate it whether it is effective or not. So from here, you could see here event-based is more on rapid detection, and indicator-based, we basically based on routine reporting of the cases. So these are the two main differences, and commonly for event-based, we have immediate reporting. And the indicator base, we are basically based on the reporting from the healthcare facility base. So for this indicator-based surveillance, it basically we need a very clear case definition, and we also based on diagnosis, and also we also based on this syndromic surveillance here. Why this syndromic surveillance here? Is because the syndromic surveillance is a little bit different from this clinical case definition. So syndromic surveillance, we have this case definition based on the syndrome and not on a specific disease. And it relies on this immediate reporting of event to the system and requires rapid risk assessment and also immediate response to that outbreak. And also it designed to detect any rare, but the outbreaks is actually impact our this population health. And the objectives of this syndrome surveillance here is actually to facilitate and expedite the notification and response using these clinical syndromes to define and capture all the diseases that potentially cause the outbreaks, and also to alert the attention as soon as possible, and also to complement other existing specific disease notification. And this syndromic surveillance is very useful for rapid response to newly emerging diseases, for example, for the current pandemic COVID-19 here. And these syndromic surveillance, the common features, we have different stages that I will elaborate later on. So event-based surveillance here, okay, so it organized and rapid capture of the information that actually cause the potential risk to our this public health implementation and involve the occurrence of disease in humans, or the we need to actually capture the event that is potential exposure for the humans. So we actually very much rely on these unstructured reports, okay, from the all the sources like internet sources, or any discussion from the public forums on, or the discussion from the different levels of the health staff workers. And this complement to the indicator-based surveillance for an early warning system here. So basically, this is the overall flow diagram for the surveillance mechanisms in Malaysia. So as you can see here, we have laboratory surveillance, mandatory notification disease surveillance, clinical-based surveillance. We have a sentinel or syndromic, or we have, and also the fourth one, we have a community-based surveillance. And also the fifth one is by other agencies, either for the FOMEMA, for the foreign worker, or these zoonotic diseases. So all these five surveillance, we have actually go through these three levels of in our this Ministry of Health. We have reporting from the these private or the public health facilities to the nearest district health office. And also the second level, we will go up to state health department, and finally to our this national level in this Ministry of Health Malaysia, in our this the core in Putrajaya in Malaysia here. So what is the first one, the mandatory notifiable disease surveillance? Is started since 1967, and with the malaria eradication program here. So since the 1970s here, we have a surveillance of 36 notifiable disease, and it falls under the section of this Prevention and Control of Infectious Disease Act 1988. And falls under the category that the diseases that to be notified within 24 hours or a week, we have 27 of infectious diseases out of 36 diseases here. So every medical practitioners, we need to actually notify the diseases to the nearest district health office. So they are basically based on the case definitions here, with these specific clinical and laboratory criteria. So here is the examples of these list of notifiable communicable diseases. Of course, you can get the full list from the Preventions and Control of Disease Act 1988 here. So you can see here we can have this notifiable disease by phone within 24 hours, which is required for cholera disease, the cholera or food poisoning. We have dengue fever, diphtheria, dysentery, Ebola, food poisoning. So this is falls under, we need the medical practitioners need to notify the disease to the nearest district health office within 24 hours. So there are also diseases that need to return notification within 1 week. So for example, for AIDS, for HIV infection, for this dysentery, and also other infections such as this viral hepatitis A, B, and C. Okay, and also we need for the notifiable which disease actually need the lab confirmation to actually to form up the case definition. And also we have classified the notification by the either with the only clinical diagnosis or this laboratory diagnosis, or with the confirmation with both clinical diagnosis here and this laboratory diagnosis. So second, we will move on to this laboratory-based surveillance. Laboratory-based surveillance basically introduced in August 2012. And this system provides the report of microorganisms isolated in all our public or private laboratories in Malaysia to the relevant health authorities here. So we have 6 types of bacteria here to be isolated currently. So we have this cholera, influenza, salmonella typhi, and this leptospira. And these are the 6 main types of bacteria are being prioritized to be monitored and by the microbiology laboratories from the MOH Malaysia. The objectives of this laboratory-based surveillance is to detect any emerging pathogen strain, and to predict or to detect any outbreak, and of course for the monitoring and the evaluation for the current our public health program. So in this laboratory-based surveillance, for the pathogens identified, we have these 3 different types of surveillance here. We have a sentinel surveillance, okay, viral national surveillance, and these non-viral pathogens here, which is classified into these 6 types here. So what is called this sentinel surveillance here? The sentinel surveillance is actually this it's a continuous surveillance. For example, like our current the dengue or these enterovirus, the hand, foot, mouth disease is actually a yearly outbreak, or we call epidemic here in Malaysia. So that's why these dengue, influenza, and enterovirus fall under this sentinel surveillance. And we also have the viral national surveillance, which are the Japanese encephalitis and MMR. And of course for the non-viral pathogens here. And basically the flow for this laboratory-based surveillance is similar as in mandatory disease surveillance, but the difference is from the laboratory isolation here. Then any detection, they will notify to the nearest district health office, and to the state level, and also finally to the our national level. So third is the clinical-based surveillance. Clinical-based surveillance, we are also limited to specific infections, either national basis or a sentinel basis. For example, just now I mentioned for the dengue, for the influenza, or the hand, foot, mouth disease. So a more comprehensive syndromic-based surveillance, okay, we actually look into these few syndromic here. Acute jaundice syndrome, acute neurological syndrome, acute respiratory syndrome, and also dermatological syndrome, and finally acute hemorrhagic fever syndrome, and also the diarrheal syndrome. So these are the main comprehensive syndromic based surveillance that is introduced in 2003. So any detection of this syndromic disease by the ENA department from this public or private university, So they will actually the medical practitioners will notify to the nearest district health office, and second stage to the state, and finally to this national level. So this syndromic surveillance here, okay, is actually the common features is we have three different categories here. We have acute stage, severe illness stage, or actually the patient actually absence of or don't have any factors here. So for the acute case, it actually defined as the period of 3 weeks or less, or the if the patient classified under this severe illness is actually classified by at least one of the following, it needs a hospital admission or major organ failure, or they have this circulatory collapse, and finally death. So the patient will fall under the category of a severe illness. And for the category of absence of known predisposing factors, it is the absence of known these underlying diseases or other factors such as drugs, so which can explain the occurrence of the syndrome. So the initial presentation, the symptoms to be very non-specific. So the patient actually advisable stay at home or away from work, and also self-treated by the over-the-counter drug or any traditional Chinese medicine or traditional complementary medicine. And so when illness progress or severe, they were actually admitted to the A&E. So the syndromic approach, the main aim is we actually focus on the syndromes rather than a case on a disease. So, and also before the laboratory confirmation is available, because not laboratory based, but when supplemented will enhance the power and the specificity of the system. So what is this syndromic approach? Okay, and it actually we conduct this clinical investigation of cases. Okay, a group of these syndromes, and the type of specimens to be collected also will depend on this syndrome that we group. Okay, so either is under respiratory or either diarrheal syndrome. So they will send the specimens to the reference laboratory for higher end of tests, and also to our this Institute of Medical of Research. And they have a special package for collection and transportation, especially and also they will have special attention for this hazardous material. The fourth one would be the disease surveillance by other agencies. For example, FOMEMA. FOMEMA is the surveillance for actually the foreign workers. Actually, the FOMEMA is one of the agency. They work together with our Ministry of Health Malaysia, and this Ministry of Agriculture Malaysia. So all the actually foreign workers that before they depart in Malaysia, they need to test for HIV, hepatitis B, this syphilis, drug test, and also the pregnancy test. And before the departing from their country, and also 1 month arrival in Malaysia, and at the end of the first year, and also at the end of the second year. So if the foreign worker continue to work in Malaysia, so they need to screen for these the disease that I mentioned just now at intervals of every 2 years, okay, as long as they are employed in Malaysia. And besides this, for the foreign workers, we also have actually work together with the Ministry of Agriculture, the Department of Veterinary Services that actually take care of these zoonotic disease surveillance. So as you can see here, so these are the some of the diseases that list under these zoonotic diseases, which actually bring the public health importance here. So we have a rabies, we have a Nipah virus, avian influenza, JE, brucellosis, and leptospirosis here. So finally, we have this community-based surveillance. Is basically we actually monitor the rumors, okay, or reports on the infectious diseases from the committee, and also from the media, either from the hard copy or from the electronic, from the soft copy, both nationally or and also internationally. So this communicable disease surveillance section, CDSS, Ministry of Health, and also all states health officers and district health officers including all these entry points, okay, should play this very proactive role in this monitoring these rumors, local press and media reports. And once any rumors, they actually feel they predict any outbreak, so they will actually take the prompt action to actually verify these reports in their areas of jurisdiction. And this remote surveillance is actually one of the system for this early warning surveillance, okay? And it falls under this event-based surveillance here. So it is very important to enhance the surveillance for these rapid detection outbreak or these unusual events. So we need to respond it as soon as possible. So we mainly relies on the information we gathered daily, okay, from the newspapers, from the forum discussion, okay, whether from the internet or any forum discussion through the radios and emails from the public, okay, and of course the word of mouth from the public is also one of the remote surveillance system here. And we actually, the health staff were asked to gather information from also from the police station and from the pharmacies and private clinics or hospitals. So this actually will be done daily or once in 2 days. So there are also additional types of surveillance system in Malaysia. We have active surveillance and also passive surveillance here. So passive surveillance, we actually very rely on this, our healthcare providing. And major limitation is most of the notifiable diseases are actually underreporting. So for this passive surveillance, so active surveillance, for the current pandemic, these health volunteer, okay, we actually perform this active surveillance to actually identify cases, okay, in this public to determine these incidents and these epidemiologic characteristic of this disease. So basically, our surveillance activities, okay, will have the three levels here. From the once any notifiable disease been confirmed based on the case definition, okay, then the medical officer of health will actually responsible of collecting, analyzing, interpreting all these data that will suggest any outbreak is it occurring within the district. Then they will report to the state level. The state level will also perform the same process that will suggest that any outbreak is occurring in more than one district in the state. And finally, the national level in our Ministry of Health Malaysia, so the Communicable Disease Surveillance Section in this disease control division is responsible for the collection from all state of health officers, and also they will collect the data from these laboratories under the laboratory-based surveillance system and directly reporting from the physician under this syndromic surveillance system. So at the national level, they were actually collecting all these relevant data from a different district and state, and also directly from the physician to actually confirm whether there is an outbreak happened. So this is the overall diagram for the surveillance activities conducted in Malaysia. So they will collect data, compile, analyze, and interpret. And also the dissemination for the action, whether any public health action will be implemented to further actually prevent and control the disease outbreak. So as I mentioned just now, we actually based on the case of infectious diseases, and then we were reporting the physician from the public sector or the private sector, and notify to this the nearest district medical office here, and also to the from the district here, they will actually report to the state and finally to the national level. So one of the case example that I will discuss here is the severe acute respiratory syndrome, SARS surveillance in Malaysia. So the general objective for this SARS surveillance is to identify ongoing patterns of SARS occurrence and for effective investigation, control, and prevention. The specific objective is to collect, analyze, and interpret data on SARS, and also to produce and disseminate reports, okay, to those who need to know, and also to initiate further epidemiological and laboratory investigation if they found any emerging strain of this virus. And of course, finally, to establish effective communication and information management from the district, state, national health levels, and also finally to disseminate to the public. So for the case definition of SARS, for the suspect case is a person with a history of high fever and also one or more respiratory symptoms of cough, shortness of breath, and difficulty in breathing, and also one of the or more of the following, which is close contact with a person diagnosed as SARS and recent travel to the areas reporting cases of SARS. So this is the case definition of SARS. And also we have a probable case, any suspect case, okay? So suspect case for SARS is with chest X-ray findings of pneumonia or respiratory distress syndrome, or persons with unexplained respiratory illness resulting in death. In addition to fever and respiratory symptoms, SARS may actually be associated with other symptoms, including headache, muscular stiffness, loss of appetite, confusion, and diarrhea. So close contact means here is having cared for, living with, or having had direct contact with respiratory secretions or body fluids of a person with SARS. So how to notify these SARS? We have all the suspected case of SARS. So they will actually, the physician or the medical health professionals will actually notify to the nearest health office using the special Ministry of Health Malaysia form. And the health office will then fax this notification form to the SARS operation room as soon as possible. So this is performed in a daily from the hospitals and also other health facilities here. So you can see we could have these government hospitals here, and also we have government health centers here. So we have actually daily reporting, okay, using the form to the nearest district health office and also to the state, and we have the SARS operation room here in our Ministry of Health Malaysia. And finally, the DDG, we call Deputy Director General of Public Health, the Director of Disease Control, we actually disseminate the information if there is any emerging strains of this SARS. So this is the samples of this notification form for this SARS to be reported. So you can see this daily report of this acute respiratory infection from the government hospital here. So based on the syndrome of this severe acute respiratory, if the patient did not present the initial symptoms here. So there is also enhanced surveillance for SARS here. So they will have a media scanning or this surveillance at any entry points, okay? And of course, we have contact tracing and in the hospital as well, and also follow up the discharged SARS patient. And finally, into the healthcare workers here. So the challenges for this disease surveillance system in Malaysia. So at the moment, we have a bulk of data and information is still transmitted in the paper form. So, and this has caused a undue delay in the analysis and the interpretation of the data. So you will delay in the response. And all effort actually must be made to upgrade the dissemination of data and information. We should actually using the one system to actually collect all this data. And public health systems in Malaysia should be strengthened at national, state, and district levels to ensure a more effective response for this infectious disease outbreak. So basically, our disease surveillance system in our Ministry of Health Malaysia, we have indicator-based surveillance and event-based surveillance that depends on the rumor surveillance for this early warning detection. we have this syndrome by we notify it based on the syndrome, and also based on the cluster, and also rumor. And the event-based surveillance, we actually need to strengthen for early detection, for especially for these new emerging diseases, or the infectious diseases, or the unusual events that is a potential bring these public health risk to the major outbreak of this pandemic. And also all these communicable disease surveillance, we actually comply with these international health regulations, IHR 2005. So this IHR is actually as a focal point, is collaborate with between this Ministry of Health Malaysia, and also with other agencies, including national and also internationally. So these are the objectives, and the overall this information about these surveillance systems here. So we have based on the disease, okay, any new emerging diseases, we actually based on event-based and also early warning information system. And of course, the in the this Ministry of Health Malaysia, we have our own health status monitoring, or these health indicators. And after they have collect all these data, analyze and interpret, we have this disease monitoring or evaluation here. So we have implement all those public health intervention or prevention control activities here. And finally, we actually have our own resource allocation, that actually all the information for this daily monitoring, and this for this early detection for the outbreak. So thank you very much. So now I bring back to the host.
Yeah, so thank you, Dr. Fu. So, student, if you have any question, you can type in the chat box. So, or student, maybe you can unmute yourself to ask the question.
Mm.
So maybe we wait for a while. Maybe some of the student is typing the question. Okay.
Okay, thank you.
Mm.
Oh, maybe may I know what's the background of the students? Is it who is under the public health? Any of the student here under the public health?
Oh, mana semua tu ah.
Maybe if you are from public health, you can type in the chat box. You type one.
Yes. Oh, okay. Thanks, Kaishan. Okay. Although it's not from public health, so but yet to know more things about our current disease surveillance, how it's actually uh, being conducted, or we actually perform all these surveillance activities, okay, when any emerging diseases happen. Okay, if none of your from Wenzhou, from the public health sector, maybe anyone can share about your current situation on this pandemic COVID-19 here? How do you come across within your district, or what is the daily activity that you need to report? Because what I know in China, okay, I have relatives in China, so they actually uh, every time they actually out from the district, they actually need to report all the time until now. Although the cases is uh, much very low as compared to Malaysia here. So anyone can share your current view on this? How do you actually overcome all these? What are the daily activity, the surveillance activity in your area there? Anyone can share? Yeah, okay. A student from Wang Jiazhen. Okay, he's from Shanghai, and there's no confirmed cases. So do you still need to do any reporting whenever you go? Or the Chinese New Year is coming? Yeah, okay. You're still wearing mask. So do you still need to report? Okay, Yao Chen report here is okay. You are more into this daily life. So the pandemic is actually integrate into your daily life already. So your mask also is necessary. So any reporting system that you all need to perform? Uh, to the Chinese New Year, they all can interstate traveling. Okay, so you mentioned about you need to report according to the school. So how about without the if you are not going to attend any school? So during your daily activity, do you still need to report? So you are reduced to the traveling. So, but then you still can traveling to other states, right? Oh, okay. So Ruby Jiang mentioned that you can actually travel to other low risk areas here. But that I believe that all the area is already under this low risk, right? Okay, you sign in ding ding every day. Okay, as Malaysia here, we actually sign in our My Sejahtera, but not every day. It's only when we visit to the any premises outside, then only we sign in into our My Sejahtera here. So you are allowed to travel only in the city. So are you allowed to travel to your home country? No, home states. If you are like for the Chinese New Year, are you allowed to travel interstate? Okay, still recommended not to travel interstate here. Oh, okay. So you mentioned you need to take the nucleic acid test and also, oh, okay. So mostly of you are already at home. Okay, that's great. Okay, you are in the long holiday now. Okay, thank you for all your comments here. And so, Mr. Tan, can I share another slide with the students here?
Yeah, you can share.
I can share. Okay, thank you. Okay, so after we have talking about this disease surveillance, so we actually have this public health. We are actually very looking into this action plan, or we call this health public health policy. To actually, we can see the public health policy. We not only design for this communicable disease. We also actually design this public health policy for these non-communicable diseases. For example, obesity, hypertension, cardiovascular diseases, and so on. So how the actually public health officer draft or this we call prepare a health policy. So this public health policy mainly is to describe the steps to develop this public health policy for this public health program. Public health policy is a fundamental tool that assists the task of protecting people for actually prevent the disease and also strive for these healthy populations here. So the disease prevention and health promotion require much broader of factors, or we so-called risk factors here. And these public health policy that actually shape health-related behaviors into these either is psychological or other health determinants, in addition to actually modify all these biologic processes specifically related to diseases, either is a communicable disease or non-communicable disease. So major health problems here requires understanding and intervention to the we need to understand the root causes of ill health, and the actually what are the policies that shape and affect these determinants or the risk factors of for these specific diseases. So according to CDC Center of Communicable Diseases 2016, so the public health concern into this public health policy, we actually look into this related to alcohol related harms, food safety, healthcare associated infections, heart disease and stroke, HIV, motor vehicle injury, nutrition, physical activity and obesity, the prescription of a drug overdose, teen pregnancy, and finally the tobacco use. And this public health policy, we actually draft or prepare according to the Sustainable Development Goal. So what is a Sustainable Development Goal here? It actually defined as development that meets the needs of the present without compromising the ability of future generations. Okay, so we have this Sustainable Development Goal throughout the country. And for Malaysia, we actually, the main aim is to eradicate the poverty in all its forms. So the main elements that need to be harmonized, we are looking into economic growth, social and environmental protection, which are actually interconnected and very important. So as you can see here, the SDGs for the international regimes and the development agenda until this 2030, we actually, the main principle is to end the poverty in all forms. And we respect all our these national policies and priorities. And within our own country, we actually look into all these policies, which actually, is it aligned with these SDGs? So according to the Lancet here, there is a baseline analysis from the Global Burden of Disease 2015 here. So related to health, we have actually 33, okay, health-related sustainable development goal here. So out of these 188 countries, okay, so you could see actually Malaysia falls this number 46, okay, that is in this second quartile range, okay, to actually achieve this SDG. So the goal number 3 is actually directly health related here. So this is the SDG related in Malaysia. By 2030, we actually, the main is to reduce the global maternal mortality ratio less than 70, okay, per 100,000 live births. And also by 2030, we actually end the preventable deaths of newborns and also children under 5 years of age. And by 2030, we need to end the epidemics of AIDS, tuberculosis, malaria, and other neglected tropical diseases, and also hepatitis and waterborne diseases, for example, like cholera, dysentery, and hepatitis, and other communicable diseases. And we need to strengthen and for the prevention and treatment of substance abuse, including this drug abuse and also harmful use of alcohol. So we also from the death or injuries from the road traffic accidents. And to achieve this universal health coverage is also one of the goal for Malaysia, including this financial risk protection, access to quality essential healthcare services. So what is the meaning for this universal health coverage here? Meaning that the population actually could access to these healthcare facilities with the affordable and also equity, meaning that all the whole population actually access to the health facilities at affordable and equity, meaning that they are not that in the poor we could not actually access to the government. It's actually all population could access the same the healthcare services. So we could say universal health coverage. So in Malaysia currently, we actually have this achieve mostly 99% of a universal health coverage here. Okay, and of course we have the research and development of vaccines here, and also we increase our health financing, because currently our health financing in Malaysia, we actually the out of pocket, meaning that we still need to pay, okay, to access our healthcare facilities. We actually for the out of pocket in Malaysian population is still quite high. It's around 40% out of pocket, because most of the Malaysian, we are still not access to government health facilities because of the long waiting time. And so we have the private insurance. So mainly Malaysian, we are still out of pocket quite high, that we actually visit to the private this healthcare. So according to this Branca et al., okay, 2019 here, okay, so the unhealthy diet and malnutrition are the top risk factors for the global burden of disease, based on the high body mass index and also malnutrition. And the most major one is the unhealthy diet here. So this unhealthy diet, high BMI and malnutrition is actually are the top risk factor for contributing this global burden of disease. So where are we now here? Okay, so we actually achieve mostly 99% of this healthcare. We call universal healthcare, and also we have the flying doctor services, especially in this rural area. Okay, so the community in that particular community could actually access to the healthcare facilities less than these 5 kilometers. And also we achieve a low maternal and child mortality, and all the newborn, we have a high immunization rate, and more than 99% of birth handled by skillful healthcare workers. So we actually, Malaysia, we've been moving on to tackle the second tier of health issues for these non-communicable diseases. For example, more on this obesity, hypertension, cardiovascular disease, and this we so-called diabetes. Okay, and also we improve sexual and reproductive health and family health, and a better delivery of healthcare services to vulnerable groups such as the poor and those with disabilities, and enhance our healthcare financing to reduce the out-of-pocket coverage. So the steps to develop public health program here, we have 8 steps here. Okay, so the firstly is to describe the problem. Okay, so before we actually public health officer prepare the public health policy, we actually need to know, is the disease causing this potential health risk, okay, to the population. So we need to describe the problem here. Okay, so for example, the current the non-communicable diseases that are actually priority for the public health officer to have the look into this public health policy. We have this CPG guideline, okay, for this diabetes, for obesity, hypertension, and cardiovascular disease. So we need to have these measurable objectives, okay, at the 4 levels, which are individual, network, organization, and society. So the goals that we actually outline in the policy is following the SMART, okay, specific, measurable, attainable, realistic, and town-bound. For example, in reality, we are going to this reduce the prevalence of tobacco use, okay, within by 2030, okay, by 5%. But our current prevalence rate of tobacco use is around maybe 20%. So that's why we need to have specific goals here, whether you need to have a long-term goal and a short-term goal. If you want to reduce by 20%, okay, by 10 years, so we need to have a short-term goal as well. Okay, so in 5 years, you will reduce by 5%. So, and following that. So the goal must be specific and following the SMART so that we can actually measure it and evaluate whether the public health policy implemented, whether it is effective or not to actually reduce the prevalence or incidence of the disease. So we need to understand the problem, what are the actually the risk factors, okay, causes the problem, and actually what are the impacts to the society and for the economy. Okay, so second, after you have defined the problem, we have to assess the readiness for the policy development. So whether you could actually assess their readiness on community level or the organizational level, because we have the current public health policy already implemented, okay? But we could actually look into the current public health policy and to strengthen it, this public health policy. So the third one is to develop the goals, objectives, and the what are the other policy options to actually towards the specific diseases. And we could actually define the clear goals and objectives for the policy change, and list down what are the policy options that actually the decision makers from the Ministry of Health Malaysia or other agencies, collaboration with the other agencies or other these private organization, and also these non-government organization to actually consider, is it that your policy you need to collaborate with other agencies or not, and assess all these policy options which actually to best fit with your goals and also objectives. And the fourth step here is to identify decision makers and the influencer, which actually focus of your these supporting building efforts to actually bring the gap closer, okay, in terms of in this media coverage or other influential groups of people that could actually make your policy more effective. Okay, after we have identified our these decision makers, we could actually focus the messages on the links between the policy and the issue, and also what are the solutions actually we need it from the public health opinion and these media coverage to actually build support for your policy. Is it that we need this strengthening in this training, okay, in terms of human resources or other states? And when times go on, we actually draft policy, a new policy, or we revise, okay, the current policy is already implemented here. And from the consultation here, we actually look into consultation services from the stakeholders, from the industrial, or from the other these academic these institutions, okay, throughout these, what are their contributions, okay, to actually when you want to revise your policy. So from the policy, you could actually, the stakeholders, they will actually look into what are the goals and objectives of your policy draft. Then they will actually draft the regulations on that policy. And how about if a non-compliance, okay, what are the non-compliance? When non-compliance, so what are the procedure to actually handling it? And also we have the plan for this promoting and disseminating the policy. And of course, finally, to evaluate the policy, whether it is effective. Like for example, we have a policy for obesity, we have a list of activity. So whether these activities actually aware from the public or not. So if the public is not aware for these activities that are outlined in the public health policy, meaning that they are not promoting enough. Okay, so for the during the revision of the policy, the public health officer could actually highlight some, or the stakeholders collaborate with the private organization to actually come up with some promotion activities to actually increase awareness of these activities for that specific disease. And finally, after you have this draft, the public health, the team could actually implement the policy to ensure the policy meets the goals and objectives, and the objectives are actually measurable. Okay, whether it is achievable or not achieved, it could some indicator. Okay, that can actually measure. And we also approve from the key decision makers and also the stakeholders before it implement this public health policy. And the timeline is realistic and appropriate, meaning that if the current I believe that the like obesity in China is very low, okay, below than 5%. But the prevalence for obesity in Malaysia among adults is alarming rate, okay, around 20%. So we could not actually, in 5 years time, we could not actually reduce the prevalence of obesity below 5%, okay. So all the objective that we outlined in the healthcare policy, it must be realistic and appropriate. We could not just put a figure and then it's unrealistic. So finally, we evaluate and monitor the policy that have been implemented here. All the while, we will communicate our findings, okay, to our stakeholders, okay, to either industrial or other academic institutions. And for examples, behaviors or health status of community members, we have a number of violations. So we have the health report, okay, by yearly, so to actually look into it whether our healthcare policy is actually effective or not. So that's all from my sharing here. So I will pass back to Mr. Tan. Thank you.
Yeah, so thank you, Dr. Fu, for the second sharing. So, student, do you still have any other question wanted to ask? You can type in the chat box. So, Dr. Fu, there's one question in the chat box.
Yeah, it's students from UTAR here. Okay, so any action plans suitable for physiotherapists? Yes, there are many action plan that is not directly for physiotherapists, but they actually those health policy related to non-communicable diseases. Okay, for example, you have this when come into pain. Okay, they have a pain for CPG guideline, or this obesity or hypertension. This is all related to physiotherapies also. Okay, so if may I know you want to draft a policy for physiotherapists, or you want to refer any this policy that related to physiotherapists, or maybe can you talk more about what actually you want to look into it? Okay. Oh, it's more about the neck problem. Okay, so basically you can look into that specific disease. Okay, they have the specific disease of for the CPG guideline, whether it's back pain or this neck pain. Okay, if don't have any specific neck pain one, you could actually look into the pain. Okay, when the CPG guideline for the pain, so they could actually tell you how do they assess for the pain. Okay, cervical spondylosis. Okay, so you could actually browse through your Google whether you can just type a CPG for cervical spondylosis. Okay, so if no, then meaning that they don't have any policy. So in terms of maybe in the future, okay, so the actually public health officer will look into this coming with this more and more for this public health policy, because not all the disease they have come out with the policy here. We actually look into these very important or priority diseases that come out the policy, like non-communicable disease. We have the combined policy here from this 2016 to 2021. Okay. Thanks, Fang Chi. So, any question?
So I think if there is no more question, then I will end the session. Okay. So thank you very much for Dr. Fu for the exciting sharing sessions. So I believe our student have learned a lot from you. Okay. So once again, thank you very much, and we also like to thank the student who joined this session. Okay. So now all the students, please kindly turn on the camera for the group photo session. Yeah. Okay, so now I'll take the first page. Okay, so student can give me a thumbs up. Okay, so ready in 3, 2, 1. Okay. Okay, I'm going to page 2. Okay, so once again, okay, ready in 3, 2, 1. Okay. So I'm going to page 3. Okay, so ready in 3, 2, 1. Okay. Okay, done. Okay, so once again, thank you very much, Dr. Fu, for the exciting and detailed sharing sessions. And also, thank you, students who participate in